Hi, I'm Dr. Todd Shakin, and welcome to this Monday Morning Minute. I hope everyone is healthy and safe and you're all getting the vaccine because it is so important to get that vaccine to protect yourself, your loved ones, your staff, and your patients. I've gotten my second dose and I had almost no symptoms whatsoever other than a sore shoulder for a day. I highly encourage you to go ahead and get that vaccine. Wear the N95 masks at work. I'm requiring it. I'm mandating it in my office that every employee wears an N95 mask all day long while they're here at the office. I suggest that to you as well. And we have millions of N95 masks available if you need some, and we're happy to get them to you at a very, very good price, $2 a piece. We lowered the price just because we want every dentist out there to have access to N95 masks. So if you need some masks, call and order your N95 masks today. Today I want to talk to you about a very important aspect of dentistry, how to sell, and how to sell, especially how to sell the Roundhouse fixed restorations that we offer our patients. Now, when a patient comes in my chair and they have a full denture and they're not happy with them, because most people, let's face it, are not happy with full dentures, upper or lower. Mostly lower is bothersome, but the upper also. What I say to them is, first I say, I introduce myself, I'm Dr. Todd Shakin, how can I help you? What brings you in today? And they'll usually say I'm having a tough time with my dentures or I don't wear my dentures. Yesterday I had a man who said, I don't wear my dentures, I can't wear them. I've had them for years, but I can't wear them. I don't wear them at all. So I say to them, are you looking for something that's removable or permanent? That's the first thing I say to them because I know the answer is always going to be permanent if I can afford it. That's usually the answer, permanent if I can afford it. Because people have already had experience wearing removable dentures and they would like the idea of something that stays in their mouth that they don't have to take out. So I show them the options, and we have to have the models available to show them the options. So I do start out with the option of a detachable bridge, detachable denture that snaps onto the mini implants. We can cut the palate out and it'll feel much better than their existing denture. And that snaps on and off. They do have to take this out to clean it after meals, and I tell them that. You're going to have to take this out to clean it after meals, then you can snap it back in. You can keep it in at night while you sleep. And they like that idea. So I'm kind of building up to the ultimate, which is a fixed bridge, which is what I want them to accept, okay? But I'm showing them an option to take either their existing dentures or new dentures and snap them into place. The next option I show them is the fixed detachable bridge, which is our Fix on 6 option. And I go through this first and then I give them the pricing. Fix on 6 option is a porcelain solution with no plastic whatsoever and nothing on the roof of their mouth. It is detachable in the dental office, not by the patient, and I explain that to them. The reason this one is a little less expensive than the permanent cemented bridge is we need fewer implants. We can get away with 6 to 8 implants for a detachable Fix on 6 restoration. But the drawback of this is it's a little bit thicker and bulkier than the cemented bridge because we have to have room in the bridge for the housings. Okay? And we now offer this, I don't tell the patient, but we now offer this in a couple versions, which is inclusive of the Zantac bridge. You don't want to give patients too many options and too much information to think about. I keep it very simple. 3 options. You can go with the removable, the semi-removable, or the permanent, okay? Now the permanent bridge is what I call our Cadillac. It's the best option we can provide for a patient. We put a series of mini implants in and we cement the teeth in. It feels just like their own teeth again. They never have to remove it. They don't have to have it taken out at the dental office. All they need to do is brush and clean their teeth and use the water pick, just like they would with regular teeth. Brush, electric toothbrush, electric water pick, brush their teeth and rinse, and they're going to be fine as long as they stay away from things like popcorn and nuts that can get stuck underneath. If they do that, they're going to have a great result. So this is the ultimate, and I tell them the price. And sometimes they want to fall out of the chair because they can't afford it. So what do we say? Well, we offer financing up to 7 years. You can pay 2 years no interest, or 3, 4, 5, 6, or 7 years with low interest. And they say, well, that might work. And the next thing you say is, how is your credit? And if they say they have really good credit, then you immediately say, how much do you want to put down for the restoration? They can put $1,000 down, $5,000 down, nothing down, I don't care. Whatever they say is fine. Then once they give me a number, I've told them it's $18,000 for a full roundhouse bridge. How much would you like to put down? I'll put down $2,000. Okay, we can finance $16,000. I immediately turn to the computer and go to my finance page to finance the dental work for them. I log in and I go to the calculator. If they want to finance $16,000, I type $16,000 in. I say if you want to do 60 months, it would be $339 a month. Or we can do 2 years with no interest at $667 a month. Which would you prefer? And let them pick. Or if they want something else, there's multiple options here. They pick the one they want. Then we go right to the application process and do the application right here with them in front of me. And within a minute or two, I have either an approval or a rejection. If I get a rejection from one finance company, I go to the next one. We have 4. Or I ask them, do you have credit problems? But he already told me he had good credit. So if they have good credit, we go right to the next application, because sometimes one company won't approve it. And this is an example yesterday. I tried Care Credit first. They approved the patient for $1,300. I went to Health Credit Services. They approved him for $995. I thought I was done. I wasn't going to get approval, but I didn't give up. I went to Patient Lending Club, and they approved the patient for $10,000. You just don't know which company will approve, and that's why it's so important to have 4 different options. We have Care Credit, Health Credit Services, the Ally, which is part of Ally. We have Patient Lending Club, and we have Green Sky. We have all 4, and now we're adding Patient Fi, which is another one. We're in the process of getting trained on that. You don't know which company will approve the patient, but once they get approved, especially if they got denied from 1 or 2 before, all of a sudden they get an approval, they're like, yes, I want to go forward. So, to summarize, we give them 3 options, always 3 options. Detachable denture that they take in and out, a detachable bridge that gets taken out at the dental office, or the cemented permanent restoration that never comes out. In my office, for an upper denture, this is approximately $10,000 with the denture and the implants. This one's approximately $15,000 for the detachable roundhouse restoration. It's actually about $15,800. And this one is about $18,000 for the cemented one. There really isn't that much difference in cost between this one and this one. That's why most patients will go ahead and choose the permanent restoration. I hope this was beneficial to you on this Monday Morning Minute. Don't forget to come to Buffalo for our first in-person lecture since COVID here in Buffalo. March 11th and 12th. It was a year ago in March that we had our last one. So it's been a year. We are so excited to welcome you back to our training facility here in Buffalo. We are going to be limited to 50 people, according to Governor Cuomo, but we can have 50 people with safe social distancing. Our room holds 140. We'll put seats between you. You'll wear your mask and we'll be very safe. We'll check everybody's temperatures. We'll do all the protocols. But come to Buffalo, March 11th and 12th. Sign up today. You're going to love it. We're going to teach you all about minis and monos and all the lab work and everything in between here in Buffalo. It's a 2-day course. Come see us. Our Las Vegas course, which we're having this week, is sold out, so we can't take any more this week in Las Vegas, but we're very excited that we have 50 doctors coming to Las Vegas this week, completely sold out. They're limiting to 50 also. But Buffalo, March 11th and 12th is open. Sign up today because it will fill up fast. I also want to remind everybody, we're running our special on the masks. If you buy 10 implants of any kind, you'll get a box of 25 N95 masks for free. If you buy 25 of any kind of implants, you'll get 3 boxes of N95 masks for free. You need to be encouraging your staff to use the N95 mask, and I'll tell you why. Just yesterday, I got a message from one of my patients on the review site saying that they were very happy with the treatment they received here, but one of the assistants did not have an N95 mask on, and they had a regular surgical mask, and it bothered them. And they said the doctor wore the N95, the hygienist, but one of the assistants wore a regular mask, and it bothered them. And because of that, I just mandated that everyone in my office has to wear an N95 mask all day long while they're here in the office. So your patients pick up on these things. They really do. They see the news. They understand that N95 masks are the gold standard right now with COVID, and the pandemic's not going away. You should be encouraging your staff to use N95 masks. Actually, I recommend mandating it. I made that decision yesterday. So if you need N95 masks, we have them available. We're running our special offer, but we're also giving them away with purchase of 10 implants, a box of masks free, 25 implants, 3 boxes free. And you're gonna love these masks. They're very easy to breathe. They tested at 99% filtration rate through NIOSH and through ICS Lab, both. So our masks are way better than the majority of the N95s on the market. I look forward to seeing you all on the next Monday Morning Minute. Thanks for joining me.